Thank you for taking the time to view our video. We would like to spend some time giving you some information on the Transition to Practice programs that are offered by the Child and Adolescent Health Service. My name's Stephanie Christie and I'm currently coordinating the Transition to Practice program for the Acute care stream. The Child and Adolescent Health Service acknowledges the traditional custodians of the various lands on which we work, and we pay our respects to elders past and present. You may hear us refer to the Child and Adolescent Health Service as CAHS. At CAHS, we strive to exemplify 6 core values, namely compassion, collaboration, equity, respect, excellence, and accountability in all that we do every day. Our values were chosen by our people, and we aspire to live them in all aspects of our work and interactions with our patients, families, and clients. Our health service is uniquely positioned to ensure all children get the best start in life and receive the best possible care. Our services are delivered at 2 main hospitals, Perth Children's Hospital and King Edward Memorial Hospital, and across the network of more than 160 community clinics across the metropolitan area. CAHS has 4 main service streams: neonatology, the Child and Adolescent Mental Health Services, Community Health, and Perth Children's Hospital. I would like to introduce you to some of my colleagues who will provide a brief overview of these services. So I have got with me today Libby Smallwood from Neonatology. I have got Deb Reid from Community Health, Olivia Strudwick from the Child and Adolescent Mental Health Service, and I will speak briefly to Perth Children's Hospital at the end as well. Thank you.
Hi everyone, my name's Libby Smallwood. I'm a staff development nurse on the neonatal unit here at CAHS. Our neonatology service at CAHS is the largest neonatal intensive care unit in the Southern Hemisphere. We have 122 beds between our 2 units at King Edward Memorial Hospital and Perth Children's Hospital. The units at King Edward's have 92 beds, which are predominantly for inborn preterm and sick neonates. Outborn babies and those requiring surgical or specialty procedures are cared for at our unit at Perth Children's Hospital, which is a 30-bedded unit. King Edward Memorial Hospital admits around 3,000 babies every year, and around 1,000 of those are born at less than 28 weeks gestation. All complex or high-risk pregnancies are cared for by the fetal maternal unit at King Edward's, and those babies are then cared for in the neonatal unit at King Edward's. The PCH NICU provides tertiary level and high dependency care for any baby requiring surgical procedures or specialty care requiring specialised investigations. And we're the sole tertiary surgical neonatal unit in Western Australia. The neonates are admitted to PCH with a variety of neonatal surgical conditions and congenital abnormalities. In addition to this, we also admit outborn babies, so those that require neonatal intensive care that are born outside of the Perth Children's Hospital, King Edward's Memorial Hospital, and they are brought to our hospital by the Neonatal Emergency Transport Services, NETS WA. NETS WA operates out of PCH and is a state-wide retrieval service for newborns that require urgent or specialised care. They retrieve and transport sick neonates from the metropolitan area and regional sites across Western Australia with the assistance of the Royal Flying Doctor Service. We also offer a structured learning pathway on neonates that will take you from the beginning of your nursing career right through to senior nursing. We work through foundations of neonatal care, leading on to a level 2 course which involves rotations between the 2 sites. Then building on that, we can look through to neonatal training courses, specialised training in NETS WA, and then senior nurse position pathways later on. We'd love to have you come and work with us on neonates, and hope to see some of you in the future. Thank you.
Hi everybody, I'm going to talk to you about community health. So community health is a metro-wide service consisting of 19 regions. We have 9 in the north zone and we have 10 in the south. And these span from Wanneroo, Two Rocks in Wanneroo North and down to Preston Beach in the south. We also go inland to Hills region and all the way in the hills. So we cover a huge geographical area. So our point of difference in community health is that we look after well people. So we look after well children, and it's all about preventative health and keeping children out of hospitals. We conduct various screening programs and provide health promotion in a variety of settings. We are located in community centres such as child health centres. We're in the school environment, and we're also located in community centres as well. We have child and parent centres and other facilities that we also share with other services. We work in a family-centred care model, and we walk alongside our families and build their capacity and their health literacy with consideration of their social determinants of health. And I will talk about our services a little more in detail in a couple of slides. Thank you.
Hi everyone, my name's Olivia and I'll be talking to you about CAHS and our services. So currently we provide acute, specialised and community services. Within these services we provide inpatient and outpatient services across the metro area. At Child and Adolescent Mental Health Service, we aim to offer services such as support, advice and treatment to young people and their families experiencing mental health issues. CAHS provides recovery-focused programs and services for children aged up to 18 years old. Thank you.
Okay, so the fourth service stream is Perth Children's Hospital. So this is the big green building that you may have seen in Nedlands, and Perth Children's Hospital is WA's only paediatric hospital providing tertiary services for the state. So that means that we care for the sickest children in WA here at PCH. The hospital includes the state's paediatric trauma centre. We have inpatient, outpatient and day stay care facilities. Excitingly, PCH also has an integrated paediatric research and education facility as well. So if we move on to discussing the transition to practice programs themselves, we have a variety of streams, and our transition to practice programs offer 12-month contracts, so 12-month programs with 3 main streams. So we have acute care, community health, the Child and Adolescent Mental Health Service, and we'll speak about each of those streams individually shortly. Each of the streams have a comprehensive orientation program, study days throughout the 12 months, as well as tutorials or Strive forums, and you'll be supported by a dedicated transition to practice program team as well. So if you are quite visual like I am, this may be quite helpful to have a look at. So we think of our CAHS, Nursing to Transition to Practice program teams, as a umbrella. And so under CAHS we have the acute care stream, community health, as well as CAMS, the Child and Adolescent Mental Health stream. So I'm going to speak through the acute care stream to give you a little bit more of an understanding about what is on offer. So within the acute care stream, you would complete 2 6-month rotations, and you would be allocated to a stream within the acute care stream, which is going to make things start getting a bit confusing, but I'll try my best. So if you were to be allocated to the medical stream, for example, you could be allocated anywhere in the PCH inpatient wards. We send our grads to all inpatient wards except Ward 3A, which is our intensive care unit. There are pathways to intensive care after your grad program, however, if that is something that you're interested in. You may be allocated to outpatients, our day treatment unit, our emergency department, or neonatology. So neonates comes under the acute care stream, and that may be a rotation either in the King Edward or the PCH nursery. So that's something that sometimes people get a little bit confused at. We don't have a neonate stream within our program itself, it sits under acute care. We also have opportunities for surgical and perioperative, where you may be placed in theatre, PACU, on our long stay surgical or short stay surgical units. We have an adolescent mental health stream within acute care, where your rotations would be on Ward 4A, our adolescent inpatient unit, which cares for medical specialties for adolescents, so teenagers, and a rotation on Ward 5A inpatient mental health. We have a new and exciting stream for oncology and haematology, where you would complete a rotation on Ward 1A, which is our inpatient area for oncology, haematology, and a second rotation in Clinic H, which is our outpatient or day stay therapy area. We also have a specialty stream whereby you would complete one of your rotations on a medical unit and another rotation alongside a clinical nurse consultant or clinical nurse specialist within a medical specialty. So some examples that we have at the moment are some grads who are working with the diabetes team, who are really upskilling in the way of their diabetes resource nurse management and providing care for patients who are newly diagnosed. We have graduates in immunology and cardiology as well, just to name a few. As I mentioned, the acute care stream will consist of 2 6-month rotations. Our contracts going forward for this particular stream are a 0.8 FTE contract, and that probably doesn't mean much to you with that sort of lingo, but 8 shifts a fortnight is what 0.8 FTE means. So with continuous shift work, an 8 shift a fortnight roster is quite handy. So you'll be supported by our dedicated TTP team. So that consists of the nurse educator, so that's the program coordinator. We also have a clinical nurse educator who works full time, as well as a team of staff development nurses. And those staff development nurses are separate to the SDNs that you will have on your ward. So they don't have their own patient load, so they're available to you to come out onto the floor to help you with your patient assessment skills. You might be caring for a patient with a skill that you're required to do, like oxygen therapy that you haven't done before. It might be humidified high flow oxygen, and you can get some additional clinical support at the point of care. So we are really excited about that new role. It's been working fantastically this year, and we aim to have that position covered 12 hours a day, Monday to Sunday. We have an intensive orientation program because we want to be able to give you the skills to care for paediatric patients and their families in a safe and effective way. And we understand that many of you will not have had the opportunity to have a paediatric placement, and that's absolutely okay. They are very few and far between. So we want to give you that knowledge at orientation because we don't expect that you will come with that. We have study days throughout the program, as well as Strive Forums. So Strive Forums are an education session run between 2 and 3 p.m, which is our double staffing time. And this could be workshops, it could be clinical case studies, it could be debriefs. We've introduced simulation education into our program recently, which is fantastic. We do have a state-of-the-art simulation suite here at PCH that you'll be able to get involved with. We also work very closely with the work health, safety and wellbeing team. We want to give you the opportunity to debrief, have clinical supervision and have the best start to your career as possible, and so we work quite closely with WHSW and our team of clinical psychologists here to ensure that we provide that support as well. So at present, if I'm to speak about our intake numbers, we are taking 42 graduates per rotation. So that would be about 84 per year. Things can always change, but at the moment that is our number, which is certainly expanded since previous times, which is really exciting. So hopefully you are really keen to apply for our program. So if you are interested in the acute care stream, our recruitment is done via Grad Connect, which is the centralised recruitment website for WA Department of Health. So you would like to select the Public Sector Child and Adolescent Health Service RN option on the drop-down menu. We take 2 intakes a year, so in February and in August. So if you're wanting a February start date, recruitment is completed via Grad Connect mid-year, and if it is August that you are after, recruitment is completed via Grad Connect at the beginning of the year. If you have any more questions, please don't hesitate to contact us. The CAHS.nursing transition to practice program at health.wa.gov.au email address will come through to the program coordinators, so please feel free to send us an email with any questions, or alternatively you can contact CAHS Nursing Education on 64560515. I'm going to pass back over to Deb.
So, to provide you with some more information on the community health stream, it is also a 12-month transition to practice programme, and it will commence in February each year. We will just have the 1 intake per year, but we will have more numbers in February, so we won't actually have an intake in August, but you can still apply through Grad Connect for both intakes. So as part of the graduate programme for community health, you can undertake, or you will undertake, the graduate certificate in child and adolescent health nursing. So we will support you through that grad certificate, and that will be one paid study day each week, where you will be able to complete your assignments and your workload through Curtin. We also have the Comprehensive Orientation Clinical Skills Week, so we will also have a week at PCH doing the orientation programme with the acute care stream, but we will also have a week of specific skills, clinical skills for community health, and then you will start in your region. So we do have a variety of community health settings and services that you might be allocated to. And we also work Monday to Friday. No weekends and no night shift, which is one of the bonuses of community health. And as mentioned, we do have those protected study days throughout the uni semesters. So just to give you a bit of more information around the services that we have in community health. So we have our school health stream. So we have nurses that will be working within high schools, primary schools and education support services. So within the high school, the nurse is actually allocated to a high school and will work within the student services team and work at the school. They will see a variety of students as part of that student services team, and they will help support students with mental health issues, any sexual health issues. There's quite a lot of health promotion that happens in the high school space. And yeah, so the nurse is actually part of that school team. With primary school, the teams are based at a community health base, and they will go out to the primary schools. And this is the where we would do our screening for the predominantly kindy children, but we do targeted assessments throughout the primary years. So we do hearing assessments, which include the audiometry. We also do the audiometry, otoscopy, tympanometry, and we do the Lear chart. We use the Lear chart for vision assessments as well. So we also do height and weight and lift the lip assessments in primary school. In education support services, those nurses are actually allocated to work in an education support school, and they're usually within a team. And those nurses will be doing more clinical skills, such as it could be peg feeds, medications, could be some trachea care or catheter care, those sorts of things. So we also have our child health stream. So you probably some of you may be familiar with the Purple Book, and we do those child health checks from birth to school age. So we see those babies usually within 10 days of them leaving hospital, 10 to 14 days of them leaving hospital, and then we will see them for their scheduled checks throughout whilst they're, till they've reached school age. As part of the child health services, we also have our breastfeeding service, which sits under there, and we have nurses who are lactation consultants, and we also have our enhanced home visiting nurses as well, who work with our in partnership with our more parents who have more challenges, and they'll work more one-on-one with those families. So our other services that we have as well, we have an Aboriginal health team, and those work with our Aboriginal families in partnership with them. We have a refugee health team as well. That's quite a small team, but we do have centres throughout North and South for refugee health. Immunisations is another area that we have, and we have sort of two areas for immunisation. We do the 0 to 4 immunisations, so that's all of the primary schedule for children, but we also do the school-based immunisations, so we have teams of nurses who go out to schools and work at immunising those high school children. Nocturnal enuresis as well, so that's our sort of bedwetting service. We have community centres throughout the metro region which will see families for nocturnal enuresis and with referral from a GP. And then we have our child development services, which is all our allied health services, so all our speech, OTs, audiologists, all of our allied health work in the child development services, and a lot of our facilities are co-located with our child development services as well, which is really good. Yes, so how to apply. So as I just briefly mentioned, you can actually apply in both intakes through Grad Connect. However, we do only have a February start, a February intake. So the programme will run from 12 months starting in February only. If you do want any information, the CAHS Nursing Transition Practice Programme email is there, and also the number. Thank you.
Okay, so I'm just going to speak a little bit about the CAMS stream. So currently we have 2 6-month rotations across acute, specialised and community services. So what's involved in these services is acute covers inpatient, which is 5A within PCH. They also cover eating disorders, paediatric consultation liaison service, CAMS Crisis Connect. Currently, our specialised services that are included in the program are Touchstone and Pathways, and then our community sites across the metro area as well. So while you're in this program, you'll complete a graduate certificate in clinical nursing, which specialises within mental health, and that's through ECU. We have monthly education days, and on top of that, we also have specialised mental health training as well. We have dedicated transition to practice program clinicians and SDNs throughout a few of the services as well. Dependent on the area, you will either have a rotational roster or you'll have clinic hours, which are Monday to Friday. There will be 2 weeks of comprehensive orientation and mental health clinical skills training within the first 2 weeks, which will involve your clinical skills, mental health, and then we'll also go through your therapeutic crisis intervention training as well. Some of the services that we currently include in the program is Ward 5A, which covers our inpatient unit, Consultation Liaison Service, which provides services to PCH. We have our CAHS Crisis Connect, which is our telehealth service, and they also do ED assessments as well. We have Touchstone, which is our program, our community program for adolescents. We have our Pathways program, which is for children 0 to 12, and they do day programs. We have our Eating Disorder Service, which provides inpatient and outpatient services. And then we have our community CAMS clinics, which provide community mental health services. If you would like to apply to the Child and Adolescent Mental Health Service, please follow through the instructions on Grad Connect. We do 2 intakes a year, one in February and one in August, like the CAHS stream as well. If you need any information, please don't hesitate to either contact me via email or phone number. Thank you so much, everyone, for listening to our talk, and we hope to see everyone in the future.